Hello, hello. Welcome back. This is Dr. Delon Canterbury. Again, you are tuning in to another episode of the amazing Red Pill versus Blue Pill. And I am the founder of Geriatrics, where today we'll be discussing 3 simple ways that you can use deprescribing to increase your clients and increase some revenue for your practice. So, again, I am a board certified geriatric pharmacist. And I, again, am the founder of the Deprescribing Accelerator. So welcome, welcome, welcome. I'm so glad you are back. We're going to go through a little bit of how we can not only monetize deprescribing, but really how are we serving for the greater good of, unfortunately, our broken healthcare system. And so as your chief deprescriber, aka Morpheus, aka Decanter, whatever, my job is to show you a different light to how we can approach and deliver healthcare in our outdated and broken system. So, welcome. Appreciate you joining, showing some love. So, really, let's get to the nitty-gritty of what have people tried to really start thinking about deprescribing in our seniors and really reducing the harm and potential risks associated with polypharmacy and prescribing cascades and tons of over medicating that we see on average in our seniors. We know it's an issue. We know it's got to stop, but what are we doing to show that pharmacists can break out of that traditional 9 to 5 model and show how you can leverage your skill set to literally stop harmful medications in our seniors? So we're going to go through some ways how you can do that. Truthfully, one of the easiest things I feel people do in these settings, whether you're in a long-term care facility or maybe a nursing home or adult daycare center, or maybe you're just an entrepreneur, a nurse entrepreneur, a pharmacist entrepreneur who's trying to leverage a new skill set, a new service, a new model. Intrinsically, people think, all right, we know that this person's over-medicated. The first thing we want them to do is talk to your doctor, right? That's an easy win, an easy quick sell. However, it doesn't exactly work. I wish it did. It unfortunately just kind of falls on deaf ears. And patients don't exactly always feel listened to, or caregivers may not feel listened to because they don't have necessarily that that alphabet after their name, right? Some people may refer them to another elsewhere, maybe a pharmacist or maybe a social worker to help with managing some of their meds. Or sometimes you tell people to go to a pharmacy and get some help from their local pharmacist, who we know is trying their best to get everyone vaccinated, manage these COVID testing protocols, manage these metrics. So it's a tougher situation for the caregiver or patient to really jump in and really lean in and get that much needed help on how do I get off of some of these meds. So rest assured, you're going to leave today learning some 3 easy skills you can use to monetize deprescribing to show that we can literally save lives and improve quality outcomes without feeling you have to get some type of copay, but show that this is the way of value-based care. This is the way of the future. This is the way of showing people that there are avenues you can take to get off these meds safely. So let's look at the bigger picture here, right? Say we go ahead and tell our patient to just, tell the doctor what's going on, right? A lot of the times, the providers are just inundated with all types of, but sadly, menial and meaningless tasks that don't even have to do with quality outcomes. It has to do with documentation and CYA, and there's tons of paperwork in clinic, really just squeezing all you can to get as much done within a limited amount of time and a huge amount of demand with patients coming at you left and right. So let's look at that. They are stressed. Providers need people with an olive branch who come in and can help them say, here's why we need to deprescribe. Here's how we can get this done quickly. And here's how we can roll this out sustainably so we're not putting the patient in harm's way. Telling the patient to just ask the doctor to stop some meds not only puts the onus back on the patient, but you're really expecting them to remember that the next time they see their doctor. We're hoping the intention is there, but we're hoping it works. And a lot of times it falls. It just fails. The patient either doesn't remember, the patient is swamped with all types of things they're worried about to take care of their loved one, or essentially they don't believe that they have power to convince their doctor that they want their loved one off of these medications. So again, pharmacists can be that advocate, but also deprescribing advocates, people who are trained in learning how to stop harmful medications in seniors, can really be that linchpin in driving change. And the number one thing to start this movement in deprescribing begins with education. It begins with trust. It begins with coming from an angle of care and showing you're there for the patient's well-being. It's where it starts. Now, going it on the caregiver, unfortunately, is even a harder situation. Caregivers are even more inundated. They're worried about what to cook for their loved ones. They're worried about the next day, what's for dinner, what am I going to do to schedule this next appointment, because I'm so stressed with just making sure my loved one's okay. And half the time, caregivers aren't taking care of themselves. So again, you're telling them to just, hey, just ask the doc, as essentially just doesn't work. It doesn't cut it. They need that leverage. They need that standing ground. And this is where the deprescribing advocates come in, whether it's a pharmacist, a nurse, someone who is trained and passionate about stopping these meds in these seniors and showing that you can monetize that, okay? It's not a myth. It does not have to come down to an insurance copay reimbursement at your pharmacy. We can get people off of meds safely, and you can market that as a service. You can. I'm living proof if you need that, but there are plenty of people doing this right now. It does not, again, have to rely on that copay for reimbursement when you're billing a prescription. So unfortunately, sometimes people don't exactly see the benefit of using a pharmacist or someone trained in the medications to deprescribe. They feel sometimes it's just a waste of time. Is there really an end goal here? How am I really saving money? And I'm going to show you how you're saving money. If you are able to quantify and track that you are not only saving patients money, but also saving costs that are preventably incurred by our system, my friends, this is like the ringing point for insurance companies. They want people on less meds, so they're not paying. They want people who are less costly to the healthcare system, right? They don't want people who are going in and out the hospital. They don't want high readmission rates. They want all that stuff lower because they know on the back end that's costing tens and tens of thousands of dollars. Check this out. Literally a community pharmacy in Quebec, so yes, it is Canada, was able to show a reduction in just NSAIDs, okay? Just NSAIDs, particularly in patients who had heart failure. So they were able to quantify how not only did the patient save money, but they could show by just extrapolating from the number of patients potentially lives saved, potentially exacerbations reduced. They were able to show and monetize that they've saved X amount of dollars and prevented or improved a certain number of QALYs, which is quality adjusted life years, meaning you basically live longer without any type of event happening in your life, okay? You can monetize that, okay? And that's just a pharmacy retail setting. We haven't even started talking about one-on-one deprescribing services, whether you're a pharmacist with a passion for stopping these meds, but particularly in our seniors who you know are struggling the most with this. Simply starting with educational webinars, getting into your community, serving, leveraging your expertise, and understanding that you can teach people how to ask those right questions and how to build a case for deprescribing for your loved one. So if you're another senior care organization, if you're a nursing home, if you're an entrepreneur trying to roll out and start your own thing, all of these skills can be marketed, taught, and monetized without the need for insurance reimbursements. It can be done that way, but it takes a little bit longer to get that money, to get that revenue, and really to establish yourself in that realm. So let's talk about how not only can you leverage and develop educational workshops around deprescribing, creating seminars, creating summits, creating a membership within your pharmacy or organization to become actively deprescribed. Yes. Have you thought about, say, a community pharmacy, instead of charging for all these scripts, maybe offering a service to patients who want to get off meds in conjunction with their doctor? And all that takes is a collaborative practice agreement. And now you can set up a model where you're basically charging a membership fee or a subscription service just for people to be actively deprescribed. Can you imagine that? I can. It's doable. It's completely doable. It can be done. That's another example. Another way, number 2, is showing cost avoidance, showing how much money you're saving an entity, or maybe showing how many patients you're able to impact, is again, ding, ding, ding to those insurance companies, those quality care organizations, those quality improvement networks that successively look at how organizations are minimizing harm for Medicare recipients. QIOs and QINs are important. They are the ones who are Medicare's third party, who go in and make sure, hey, what are we doing to really mitigate and reduce risk? So when you start speaking the language of risk mitigation and leveraging that platform, small insurers are going to want to talk to you, especially if you're in more of a small clinic setting and you're trying to roll a partnership with a local doctor and their employers that may be around with small businesses. They love concierge approaches to optimizing care for their patients and their employees who may be enrolled in their plan. So when you're able, again, as a pharmacist, as a nurse provider, as a social worker or gerontologist, if you're able to show when people come to your clinic or to your service that you are reducing pill burden, that you're potentially reducing, say, opioids, or maybe you're reducing benzodiazepines, and you're finding out that you're having less of your patients fall in your nursing home. Those are the markers. Those are the markers that these insurance companies are dying to see and dying to pay for and dying to contract with. So deprescribing is not a myth. I promise you, it is not a myth. We didn't even talk about the number 3 yet. And number 3 deals with the power of leveraging grants, leveraging strategic partnerships. I mentioned collaborative practice agreements that you can establish while you're developing your practice. But you can also simply partner with a community outpatient setting, or it could be a nonprofit, and work together to show how you are decreasing harm. In fact, there is an area office on aging in Florida, actually in Gainesville, who already does this. It's a team of social workers and nurses, and they literally contract with, I believe, hospital in UF's hospital system. And all they do are medication home visits. They do comprehensive med reviews, and they focus on reducing the meds that worsen heart failure for a small set of people. And they have already statistically proven that they've reduced those readmission rates, those hospital admissions, those costs incurred. So there's a cost-saving element to their patients who've used their program. And of course, the quality is better. The quality is better. And this is just a nonprofit partnered with a hospital without, per se, a pharmacist. But that's not the point. The point is you have to have the will and know-how and passion to serve this community of people who are in need. And so with grant funding, they have been able to not only sustainably keep these numbers down, but grow their practice and referrals because of this. So strategic partners are critical, but leveraging grants, the US Deprescribing Network has grants available for people who are trying to put this into place now. And you don't have to be necessarily a nonprofit. I have a corporation. I still can apply for some of these grants, given that there are strategic partners I have that can help me with that. So don't feel like you have to have a nonprofit to get some of these grants. There are grant opportunities for you as an entrepreneur as well for deprescribing. So that's number 3, okay? We talked first about One-on-one services with deep prescribing. So leveraging your skill set, whether you're a pharmacist, a nurse, a provider, if you have this passion for stopping these harmful meds, you can leverage a one-on-one service and market that. You can also look at developing educational workshops around deep prescribing. It's pretty simple. Talking about the problem is going to be key to your success. And the truth is, we got 275,000 seniors dying each year. People dying each year from mismanaged meds. And that amounts to nearly $500 billion we waste each year in the US because of our lack of deep prescribing. So the problem is there. What are you doing in your practice to change your current model and literally start implementing deep prescribing? One, develop your deep prescribing action plan. Develop a system. Do you see a patient that has an opportunity for improvement in their medication care? Are they on more than 5 medications, and are they a senior? Are they using 3 different pharmacies and have 10 different specialists? Those are red flags. Talk about the problem. And you and I both know we aren't leveraging pharmacists the way we should in this healthcare system. So guess what? I ain't got time for wait for y'all to see the value that pharmacists have. I'm going to show you how you can monetize this now. I'm going to show you how you can leverage deep prescribing now. Okay. And that's what you'll gain from leaving our deep prescribing accelerator and joining the movement and choosing the red pill and focusing on what we were supposed to be doing the whole time. Not throw more pills at the problem, but focus on stopping harm in our seniors. So we discussed today the power of cost avoidance, showing and quantifying how you're reducing pills, how you're able to potentially reduce harm, whether it be through genetic testing or pharmacogenomics, which is an easy way to roll that out, or it could be opioid deep prescribing, where we're looking at naloxone programs that you can implement, and of course, use that to serve and monetize for your business. This is about service. This is about service. This is not about a sale. This is about serving. We should have been doing this, okay? Excuse my ignorance in the grammar, but we should have been done this. Been done, okay? This should have been done. It really has. So you can do this. You can do this. So start with developing your deep prescribing action plan. Start with having conversations with those patients who come in who are over-medicated and you know they need help, but it's just another, not my problem. Well, I don't see any money in this, so why bother? That is what leads to people dying. That is what put my grandmother kicked out of a nursing home because of her dementia symptoms. That is for my first patient, again, over-medicated and almost forced into a nursing home because they didn't care. I'm tired of that. And so I want you to learn how you can monetize, but not just monetize, serve. Serve by stopping harmful meds in our seniors and growing your business and clients through referrals, through word of mouth, or through these contracts you may get with these grants or with these insurance companies. You never know, but you will learn how in our course. So appreciate y'all showing love today, tuning in. Of course, I always love the feedback. What was compelling to you today? What surprised you? You know, we're so quick to think, oh, you got to get that copay from that script, and that's how you make money. No, you can serve people by getting them off of the meds and leveraging that as, again, the future of value-based care. So that is the future. That's how we step forward. That's how we break away from this broken healthcare system. So thank you for choosing the red pill today. I'll see y'all next time. Comment below. Let me know what you think. If you want to learn more about our program, sign up and apply for our next cohort. We start in June, and you will find a link in the comments. So much love. Your Chief Deep Prescriber is out. Dr. DeLon Canterbury. I hope y'all have an amazing day and week. I'll see y'all next time, and take care.